like to thank you all for coming to Fort Saskatchewan. My name is David Eggen. I am the Executive Director of Friends of Medicare here in the province of Alberta. Yeah, Friends of Medicare is something to cheer about. It's been around for 30 years now. For 30 years, Albertans have been standing up to privatization, to the narrowing the scope of our healthcare system. And Friends of Medicare is you, and it's me, and it's all the people around you.
So I'm here to represent over 25,000 registered nurses, registered psychiatric nurses, all across the province. Our healthcare system is under attack, and the big shame, it's under attack by our very own government.
You know, they're starting to hit us with 10, 15 different announcements in the last month. Each one of them is very significant. Each one of them reduces the scope of public health care, makes it less affordable for us average people to look after ourselves and to look after our families. And you know what? It's time we started fighting back.
In the last few months, we've seen some really disturbing changes in our healthcare system. A few short months ago, we were constantly hearing about the nursing shortage, and that's because it's real. It was real then, it's real now. Now they're closing 350 acute hospital beds. They're moving patients that probably should be moved into full-service long-term care beds out of hospital beds. Most of these patients will end up in assisted living and without the care that they really need, unless they can afford to pay for it themselves.
So let me set the record straight for you here. Long-term care is inside the Hospital Act. It's inside the Nursing Home Act. People are looked after with public health care in long-term care. That's a good thing. They want to move people out of that long-term care facility into an assisted living facility where all bets are off.
It is true. Alberta healthcare, publicly funded healthcare in Alberta, is under attack, and is under attack with a vengeance. We have taken on, as an active campaign now, Change to Save Alberta Hospital. This is one of the examples, a prime example of what is happening to healthcare in this province. They are picking on the elderly, the frail, and the mentally handicapped, the easy ones to pick on.
Seniors built this province. They worked hard. They went through many different recessions. Lots of women didn't even get a chance to build up a pension. And when they're declining years, we're going to look after them, because that's the kind of people we are here in Alberta.
That's why we're here today, because nurses oppose the ridiculous changes that they're making. None of them are going to equate to any improvements. Nurses in Alberta and around the world support and fight for universal health care that's accessible and affordable to all citizens.
So I got jobs for you folks. You're going to call your MLA, you're going to call the Premier. We're here specifically to talk to Mr. Stelmach. He's the person in charge. You don't make these big decisions with Mr. Duckett from Australia. You don't make these big decisions. You don't make these big decisions giving it to a bully like Mr. Lightbush. It comes from the Premier's office. So we need Mr. Stelmach to step in now to show some leadership and to ensure that public health care is there when we need it for ourselves, for our families, and for our children and our grandchildren too.